Hi. In this video, I'll talk about role of stem cell in neurodevelopmental impairments such as autism and other neurodevelopmental impairments. So I see a lot of families in the UK are being lured to stem cell, and in lot of my practice, people are asking the same question that can stem cell be done? So, firstly, there is no conclusive evidence for stem cell to be the treatment for neurodevelopmental disorder. So, just to explain that in a bit detail, so stem cell is like a cell which represent the embryonic stage of the development, where the cell can develop into any particular organ in the body. So it seems quite logical that if stem cell can actually develop into any particular organ, then why can't we just replace the problem with the stem cell and get a resolution? So although in theory it sounds quite similar, in practical, when we treat a condition, we need to know what is actually happening in the brain or whichever part of the body, and how we can actually replace, reduce, or eliminate that problem. So stem cell basically would, in theory, more like people are thinking that some inflammation is going on. So the inflammation would mean some kind of injury continuously happening in a particular part, and then if the stem cell can actually replace or reduce that inflammation, then it could be effective. But there is no evidence that the neurodevelopmental problems are happening because of a constant inflammation. The other indication would be to just enhance the brain function. So it might be assumed that if you give the stem cell, it will enhance the cognitive brain function. Again, there is no evidence to support that. Thirdly, it can be assumed that it can reduce some anti-inflammatory thing happening. So a lot of the people are kind of working that autism and other neurodevelopmental problems could just be a response, immune response for the body. So they are doing a lot of things, such as reducing particular food the child is eating. Lot of efforts are going into an inflammatory response. There's no evidence that the cause is that, and stem cell would not change the neuroinflammatory response in the body. At this stage, there is no treatment with stem cell for an inflammatory or an autoimmune problem. So there are risks involved with stem cell. For example, when you give a stem cell to a person, you would introduce a foreign thing, even though there's their own stem cell, a foreign thing in the body. So there could be rejection, and there could be rejection response from the body. Also, there is increased risk of tumors because the stem cell proliferate very quickly. So it increase your risk of having tumors. So when we put together the whole thing to say, okay, we have a neurodevelopmental condition, we have a child, we know exactly what is causing it, and we know that there is no particular inflammation happening or autoimmune condition happening in the body. So introducing a foreign stem cell to enhance the brain function or to eliminate the condition is not something that we are recommending. So please refrain from doing it. I know the internet is filled with it, and you can Google, you can go to some other European countries, get it done, or go to some other South Asian countries and get it done. But do not believe that that's going to be a life-saving thing, and do not believe that that's going to be something that we cannot provide you, and that's why we are not doing it. Some people are tapping on your anxieties and panic, so please stay away from stem cell in neurodevelopmental problems and speak with your consultant. They are uh, able to explain the risk and benefit to yourself. So this video is made in 2024, and at this stage there is no evidence, and I will highly recommend that do not fall into these traps.